I'm presenting on the Division of Child and Family Services in Provo, Utah, which is where I am a current intern in the treatment court program. The social problems being addressed by the agency consist of child welfare issues within the community and their families. So, parents suffering from drug abuse and mental illness often expose their children to neglect, abuse, and/or domestic violence. DCFS handles these situations and opens up cases that need intervention. Social policies, laws, and practices. Utah law requires any person who has reason to believe that a child has been subjected to abuse, neglect, or dependency to immediately notify the nearest Office of Child and Family Services, a peace officer, or a law enforcement agency. DCFS depends on these reports and receives their caseloads from these reports. In addition, the director advocates for bills that favor the agency and families. Recently, the agency is in support of passing a law that would increase the minimum visitation rights for parents because they believe that increased visitation rights are important for children. One issue in particular that I've been researching as an intern in the program is the fact that DCFS in Utah does not have any rights to intervene until a child is born. Therefore, if there is evidence that a pregnant mother is using harmful substances such as alcohol or drugs, the state legally cannot do anything to protect that fetus due to the lack of laws on the matter. So they have to wait until that child is born until they can open up a case. Governance. DCFS is a state-governed agency that falls under the Utah Department of Human Services. Tanya Myrup is the current director of DCFS. She works closely with the legislator to keep track and advocate for bills that are presented each year. She oversees and manages state office employees in all 5 regions of Utah, meets with department leaders to get direction from them, and share information with the regions. Casey Christofferson is the current Western Region Director. He oversees all employees in the Western Region, works with his administration to ensure the best possible services are being offered to families. He coordinates, recruits, interviews, and works closely with the hiring and training team. He also works with the finance employees to ensure funds are kept within the budget, meets with community partners and administrators to work out any issues or complaints. He studies data and prioritizes areas that need improvement, and he transfers this information to and from the state office and department. Agency structure. So within DCFS, there are 2 main programs. That is CPS, which is Child Protective Services, and the permanency teams. Under the permanency teams falls the treatment court, sex abuse, and specialty teams. And in addition, there is the transition to adult living program that provides services to adolescents and those aging out of foster care. Here I have the organizational chart for the DCFS Western Region, which is the region that I am currently interning. You can see here we have Casey Christofferson, which is the region director. And under him, we have the budget manager, the support supervisors, and we also have the clinical consultants, the trainers, and then we have the program administrators. And then we have the treatment court team and the permanency teams. You can see up here we have the supervisors, and below them are the case managers. Funding sources. So DCFS uses both state and federal funding. Most of the federal funds come through a Medicaid match of 70-30, 70% being federally reimbursable and 30% being state funded. DCFS applies and utilizes federal grants. In addition, 4E Medicaid funds are used to help foster kids and pay for continued education for qualifying employees. Leadership. The managers of each program are responsible for the following duties. They oversee caseworkers, train new employees, and provide guidance to their staff. They provide support where they're needed, such as attending child and family meetings, home visits, and wherever extra support is needed in a case. They ensure case managers are following rules and guidelines, schedule team meetings, and pass along information to their team, perform audits of documentation to ensure these documents are completed correctly, and they ensure that staff are completing mandatory trainings. The intern in the treatment court program regularly interacts with the supervisor, lead case managers, and the senior assistant case manager. In addition, we regularly interact with staff in treatment court, such as the guardian ad litem, who is the person that represents the children in court, the judge, attorneys, and we also have a designated attorney that represents DCFS cases in court. The designated vision for DCFS is Safe Children, Strengthened Families. The mission statement states, "We keep children safe from abuse and neglect and provide domestic violence services by strengthening families and working with communities." The goal in mind is to keep children safe at home or free from maltreatment while in state care. DCFS regularly collaborates with agencies in the community, such as schools when children in state custody need to be registered, DWS to apply for the specified relative grant for foster children, adult probation and parole, Wasatch Behavioral Health for mental health services, and Utah County substance abuse. They also coordinate with a variety of other agencies, including TAMF, Early Intervention and Head Start, Medicaid, and WIC. The service delivery models in the program include protection for children's safety, development, permanency, cultural responsiveness, partnership, organizational competence, and professional competence. In addition, DCFS uses the following practice skills: engaging, teaming, assessing, and planning. DCFS uses both qualitative and quantitative data to track their quality of services. Each year, they undergo a review called the Child and Family Services Review. What happens is a sample of cases are reviewed and interviews are conducted with the parents, children, therapists, treatment teams, attorney general, guardian ad litem, etc. They check for quality of services, and then scores are compiled from all across the state and submitted to the federal government. Those who have low scores are monitored and given an improvement plan. If no improvement occurs, the program risks losing funding. I got my resources from the Utah Division of Child Services Annual Progress and Service Report Manual, as well as the Utah Department of Health and Human Services website. Additionally, I acquired info from the staff at DCFS. Thanks for watching.